Hello, and welcome back to the Pleasure Principles podcast. I'm your host, Dr. Jordin Wiggins, your guide to helping high-achieving women be as badass in the bedroom and relationships as they are in business. A naturopathic doctor, author, pleasure and intimacy coach for high-achieving women who are tired of feeling exhausted, disconnected, and like intimacy is just one more thing on the to-do list. It is my mission to guide you down the pleasure path, reigniting your desire, reclaiming your feminine power, and helping you feel deeply, deeply supported, all while thriving in your career. Smart, high-achieving women that are resourceful. They have the best doctors, great educations. If they don't know it, they're going to figure out the answer. They will find a solution to their problem. They have pretty much nonstop personal development, but they are essentially clueless when it comes to mind-blowing sex, connection, and intimacy. We're good at the checkbox sex. We think we're good at sex because that, like, first we kiss, then we touch, then there's some oral penetration. Maybe one or both people orgasm. The checkbox sex, high-achieving women have that down. We are going there. The facts and evidence-based medicine that you need to know, because understanding your body as an alpha woman is the first step to experiencing more pleasure, less shame, and better sex. If you were raised in North America, Western culture, religious upbringing, chances are your sex education was a mix of fear-based messages about STIs and unwanted pregnancy. Absolutely nothing to do with female pleasure, and definitely no mention of what happens to your libido, hormones, or vaginal health as you age and go through stages of life. High-achieving women have spent years, thousands of dollars, mastering their careers and productivity. But when it comes to sex, intimacy, and pleasure, feeling fulfilled, feeling turned on, they're left feeling disconnected, broken, or like something is missing. If I was with anyone and they told me I was tight, I would have to stop them right there. It is ill-informed, inaccurate, rooted in bro science, and tight vaginas actually make sex more painful and less pleasurable. And this is happening to millions and millions of women globally. Let me explain. One of the biggest lies we've been told is that a tight vagina is the gold standard of desirability. High-achieving women, we love a goal, but tight should not be the goal, ladies. Healthy, strong, responsive should be. I had a tight vagina. And if you want to know more about my pelvic floor history, it is in my book, The Pink Canary. In high school, I would keel over in pain that would take my breath away, like a knife was stabbing between my vagina and my anus. It was undiagnosed for years. I was even shamed by an emergency room doctor for being pregnant when I wasn't even having sex. Medical gaslighting of women. I hope we've come further than that, but I doubt it. Your vagina is made out of muscle. It is meant to expand and contract when we breathe. A vagina that is hypertonic or tight is actually a sign of stress, trauma, pelvic floor dysfunction, and it can lead to pain during sex, difficulty orgasming, urinary incontinence. We are told our vaginas are supposed to be tight. Tight shuts you out. It is rigid. It doesn't respond. It does not feel as much pleasure. And I hate to say it, but we are energetically describing alpha women. And that was literally me. I used to be a tight ass. On the other hand, if you want a pleasure path pussy, it is responsive. It is turned on. It actually invites you in. This can be an experiment. If you are inserting anything into your vagina, there is resistance. It hurts. There's a few things here. One, You're probably not turned on enough. Your pleasure pulse is not high enough for insertion. 2, you could not be lubricated enough. C, number 1, about being turned on. That's another one we like to blame on our hormones, but I can go into more detail on that. If you are ever jamming anything in, it's time to stop and time to listen to your body. A vagina, and I guess it's time to talk about vulva versus vagina again in case you're new here. So vagina is the canal that the baby comes out. It is where you insert a tampon and where you have penetrative sex. A vulva, so you cannot see the vagina from the outside. A vulva is what you see externally. And it's like calling a penis a scrotum anatomically. And we would never do that to men, but oddly enough, we're confusing the part that gives men the most pleasure. We're confusing that name. So a turned on vagina, a vagina capable of the best orgasms, of squirting, will actually invite you in. If you put a finger, a sex toy, a penis at the opening, called the introitus of a vagina, a turned on vagina will actually draw it in. No forcing necessary. Now, how many of you are having sex or penetration without force, with invitation? So what are some things going on with tight vaginas? Okay, we can have pain. Pelvic pain also could be lower back pain, tailbone pain, pain in our hips, like our whole pelvic bowl girdle could have dysfunction. We could have urinary symptoms, frequent urination, painful urination, difficulty urinating, bowel symptoms like constipation, difficulty passing stool, straining, not feeling like you've completely evacuated. And of course, we have sexual symptoms with pelvic floor dysfunction, which is painful intercourse, could have menstrual painful periods, difficulty using, inserting tampons, and sometimes clinically, I'd even see some other symptoms like bloating or digestive issues, usually related to the constipation and incomplete evacuation. And then many women are told to do kegels to tighten their vaginas when they experience pelvic floor dysfunction. But your pelvic floor is already too tight, already too hypertonic, and kegels could make things worse. Oh, surprise! We are told to do something when it comes to our sexual health and pleasure that is the opposite of what we actually should be doing. If you've been following me for a while, you know that I don't hold back when it comes to calling out the real reasons why women are struggling with low libido, intimacy, and connection. But there are still some conversations that need more depth, ones that go beyond what I can share in an open forum. That is why I created The Pleasure Path, the Alpha Woman's Guide to Feeling Fulfilled, a brand new private podcast designed exclusively for high-achieving women who feel like they've tried everything, but still aren't getting the results that they want in their relationships or in the bedroom. This is my most in-depth, transformative work yet. Raw, real, and packed with insights that I've used to help thousands of women finally reclaim desire, connection, and joy. Raw, real, and packed with insights that I have used to help thousands of women finally reclaim their desire, connection, and joy. Why did this series have to be private? When I work with high-achieving women, I see the same patterns over and over again. You're exhausted, holding it all together, and still feeling unseen or unsupported in your relationship. You're constantly over-functioning, but your partner is checked out, leaving you feeling like more of a roommate than a lover. You've tried therapy, you've read the books, maybe you've even had your hormones checked, but nothing is really fixing the problem. And worst of all, you think it's you But I'm here to tell you it is not your fault. There's an entire system of conditioning that has trained high-achieving women to excel everywhere except their relationships and pleasure. It's breaking out of that conditioning that requires real, unfiltered conversations, the kind I can't always have on a public platform. That's why I had to create the Pleasure Path as a private podcast, so I could go deeper, so I could say the things that no one else is saying as it relates to being a high achiever. And so that you can finally get the tools, stories, strategies that will actually shift your reality. But don't take my word for it. You'll hear from alpha women just like you who have been exactly where you are right now. And it gets better. In episode 1, I dive into the 10 signs of anhedonia. And here's the truth. This isn't just another podcast. It's a roadmap for high-achieving women who are ready to finally feel desired, connected, and fulfilled in their relationships and in their lives. If you are ready to stop feeling exhausted and unseen in your relationship, to reignite passion and connection without forcing it or being fake, learn how to shift from over-functioning, over-giving to actually receiving, to finally understand why nothing has worked before and what actually will, then the Pleasure Path was made for you. But because this is a private podcast, you need to be on the waitlist to access it. Go to thepleasurecollective.com/alpha to join. And once you're on the list, you'll get every episode delivered straight to your inbox. This is your invitation to take the next step towards a completely different experience of intimacy, connection, and pleasure. You've done everything else. Now let's do the thing that will actually work. Head to thepleasurecollective.com/alpha and join the waitlist, because you deserve a personal life, a relationship, and pleasure in and out of the bedroom. I can't wait for you to experience what's inside. I'll meet you there. We actually should be doing. Signs that you might need to relax instead of strengthen your pelvic floor include pain during sex, lower back pain, hip pain, pelvic floor pain, like remember my stabbing pain, menstrual pain, trouble inserting a tampon, if you've had any birth trauma, if you have urinary symptoms like frequent urination, difficulty urinating, painful urinating, bowel symptoms, as I mentioned. Potential causes of a hypertonic or tight pelvic floor are holding onto core muscles while you're working out, like improper breathing while working out, holding bladder or bowels. Oh, and what do alpha women do? We are so busy working and prioritizing ourselves that we are skipping meals. We are not drinking enough. And high levels of stress, fear, or anxiety, also an alpha woman thing. Birth trauma, scar tissue, pelvic health, or abdominal health conditions can also affect your pelvic floor. So I want to teach you some new things. First of all, a healthy vagina is responsive and it should expand. So a non-aroused vagina is typically around 3 to 4 inches or 7.5 to 10 centimeters long. When aroused, it can stretch up to 4 to 7 inches. So that's 10 to 18 centimeters or more. Also, the width of the vaginal walls are highly elastic and can expand 2 to 3 times from its resting state, its non-aroused state. And that's to accommodate penetration, childbirth, other forms of stimulation. So can we just stop and think how amazing the vagina is? And stop and think, if your vagina can expand to, like for childbirth, it can expand for penetration. And I'm going to get to this in a minute. So if you have pelvic floor dysfunction, pain with sex, vaginismus, like if you've been diagnosed with any of these things, stick with me. And I'm not shaming you, I'm shaming the system. What causes expansion? Increased blood flow to the vaginal tissues, causing swelling and lubrication. Muscle relaxation in the pelvic floor that allows for elongation. But if you are in survival mode, if you are in fight or flight, many of you are having sex without this relaxation and lubrication happening. And you're thinking like, oh, must be my hormones. I'm not lubricated enough. Not really. Part of the story, but not really. Remember, I have clients in their 50s, 60s, 70s, breast cancer survivors that are lubricating, that are relaxing and accommodating anything that they want to put in their vaginas. I did not mean that like that came out. And cervical positioning changes. So the cervix moves slightly upward to create more space for penetration when we're aroused. And it also drops around ovulation for like to increase fertilization or the likelihood of becoming pregnant. Like our bodies, vaginas, everything to do with women's sexual health is fascinating and so amazing and so well designed. And I hate, like I literally loathe how much misinformation women get. So what are the things that we are telling women? What are the things that I would consider as a naturopathic doctor if a client came to me with pain during sex? Okay, for inadequate lubrication, maybe vaginal atrophy, vulvodynia, vaginismus, endometriosis, some type of pelvic inflammatory disease, fibroids, maybe a UTI if this was an acute situation, hormone imbalances, psychological factors, past sexual trauma, and all of these things are very real and they need to be ruled in or ruled out. I'm all for proper medical assessment. I'm all for running the hormone testing, seeing the pelvic floor physiotherapist. The problem that I have with women's sexual health is that these things need to be assessed. I'm going to talk about how to get a pleasure path pussy, what we need to do. Okay. Even if you don't have pain with sex, like what do we want to do? What if we want pleasure mastery, if we want amazing orgasms, pleasurable sex, what do we need to do? Okay. I'm going to tell you what to do in a second, but I need to talk about this for a minute. All of these diagnoses apply that there is something wrong with the woman, something wrong with our anatomy, that it is not functioning properly. Okay. So sometimes these women have had 3 children, vaginal deliveries, but yet they can't accommodate their husband's penis. And we're going to blame her and her vagina. But at no point are we asking, are you enjoying the sex that you're having? Are you enjoying sex with yourself? Do you feel supported? Do you feel desired and emotionally connected? Because for women, it's different. It's like yin is descending, right? So head, heart, pussy. Yang is like rising, penetrating. It's the opposite. So it's penis, heart, head. Assuming that it is the woman's body that is broken and the problem, giving all these diagnoses when we are not looking at the totality of the situation, her environment, what her beliefs are about sexual health. Like, is her husband rolling over at the end of the night after she's done a million things and like poking his erection into her leg? My pelvic floor just contracted and involuted, like thinking of that and thinking of how many women have that They don't feel supported. They don't feel pursued. They don't feel met. Foreplay is like non-existent. And I could go on. But what do we do? What do we do if we have pelvic pain, pelvic floor dysfunction? And if you do, you are not alone. 50% of women, 50, 1 in 2, have sexual dysfunction worldwide, and pelvic pain is a part of that. And I personally think that statistic is underreported. So the first thing that you are going to do is you are going to see a pelvic floor physiotherapist. Okay? Hands down, something that you should do if you have pain with sex or pelvic floor pain. The minute, so I was undiagnosed, misdiagnosed for years, to the point that the doctor said to me, like, here's your prescription for antidepressants, like, because they couldn't understand my pain or see it on imaging or in my blood work, they thought that I must be making it up. Okay. Pelvic floor physiotherapists have extra training. They are qualified professionals. So if you have pain with sex, any of the bowel issues that I mentioned, you should be seeing a pelvic floor physiotherapist. I also recommend seeing a pelvic floor physiotherapist before and after pregnancy. Okay. Now, this comes with a caveat. If you think that a pelvic floor physiotherapist or a doctor, a hormone specialist, your OB/GYN is going to fix the mismatched libidos in your relationship, your feminine burnout, your anhedonia, and your sexless marriage, you are sorely mistaken. That is one hole that we need to plug in our pleasure tanks. It is an important one because if sex should not be painful unless we want it to be. But if sex is painful, we're not going to want to have sex. And sex is a reward system. Okay, the more good sex we have, the more good sex we want, which is another reason why I've been training clinicians to ask, are you enjoying the sex that you're having? If you're not enjoying the sex that you're having, you are not going to have a pleasure path pussy. You will not be aroused and lubricated and increased blood flow. You are having sex in a fight or flight state, and it is just not as pleasurable, and it is difficult to orgasm. Speaking of pleasure path pussies, my client on our call the other day, she kind of leaned in. We've been working together for a bit, and we're very comfortable sharing anything in my groups and with my private clients, but she kind of leaned in, and I was like, ooh, this is going to be good. She's like, I have been having multiple orgasms, and it is like we are in high school again. And she said, my husband is so turned on by me that like he's almost not lasting long enough. And I said, well, let's you've learned some new tricks, you've expanded, you've totally shifted how you're showing up. Let's give it a little time and see if this is an issue that actually needs to be addressed. But that is a responsive, turned on, lubricated, expansive pussy that is inviting. And it is turning her husband on, driving him insane. And this has happened more than once. When we connect a woman to her pleasure, when she has pleasure mastery, literally no one says no to a turned on woman. And if you want that to be you, there are 2 ways to work with me. The first is private coaching, where you are getting one-on-one personalized support to reignite your intimacy and step into that step into your feminine power. Be that turned on woman, have a pleasure path pussy. It is possible for you. And yes, you should know that almost all of my clients kind of cringed at the word pussy when they were where you are listening to the podcast. And now they can communicate in and out of the bedroom much more freely and in a way that feels aligned to them. They can say pussy now without giggling. I have a limited number of spots that I can take. I have 5 spots for the rest of the year for my private coaching. You can listen to episode 164 on how to move through feminine burnout and talk about my most recent burnout. But I am limiting my coaching spots because I'm writing another book. If my work speaks to you and you are sick of having so much and settling for less in this area, head to the show notes, thepleasurecollective.com/coaching, and apply. You and I will get on a call. We'll make sure it's a fit. We'll talk about what you can expect to see change and shift, evolve in 3 months. So the time to do that is now. And I'm so happy to share that I'm reopening my group coaching. This is something that I did in the COVID days. And when everyone was zoomed out, I stopped doing it. But there is a call for community. There is a call for connection. And this is a way that we can heal shame. We can use other high-achieving women as a resource, because the amount of sharing that goes on, the amount of oh, wow, I'm not alone, or other people are feeling this too. The level that you are seeing, the community is a part of the work. And this is small groups. This is highly curated. It is intimate, and it's done by design so that you feel comfortable sharing and healing and growing and finding your pleasure in a safe container of alpha women. And did I mention that this is extremely cost effective? So if you have been waiting to work with me, okay, you would have not been able to get on my calendar for less than $10K before this. So run, do not walk. The problems in your relationship are not going to get better. They will get worse. I've been doing this for 10 years. And if it's not your relationship, then it's going to be your health. Something is going to give. The cost of being unfulfilled in this area is like smoking 15 cigarettes per day. It is time that you take aligned action and you focus on you and your pleasure. So I recommend seeing a professional. Pelvic floor physiotherapist being the first. We've got your OBs, your doctors. And if you've done all the things and that isn't working, it is a pleasure problem, and you should be applying to be a part of my group coaching. Other things that you can do is a jade egg practice if done correctly. Great way to get in touch with your pelvic floor. Great way to improve orgasms. Also, deep breathing, full body relaxation exercises can help you cultivate the responsive, pleasure-filled, pleasure path pussy instead of having a clenched, painful, rigid one. And you know it because you can give off the vibe. You can feel this from other women, whether you know it or not. As my friend and energy healer, Brenda Johnston, says, energy speaks before you even open your mouth. You can tell the sex, the orgasms that a woman is having or not having just by her vibe. And no one says no to a turned on woman. You think you're closing deals now? You think you're crushing it now? Wait until you have a responsive pelvic floor. Wait until you have pleasure mastery. We also have meditations, visualizations, exercises to relax and make your pelvic floor more responsive. And I find 9 times out of 10, that is exactly what an alpha woman needs. And I have these in spades in my programs. We're teaching you the things that is actually going to move the needle on the life, the relationship that you desire. So for once, alpha, let's prioritize you, your pleasure, and your pussy. Let's put you first. Until next time.